How did medieval Europe quarantine during the bubonic plague? Have you ever wondered how people in medieval Europe dealt with the terrifying spread of the bubonic plague? This deadly disease, known as the Black Death, swept through the continent in the 14th century, and the response was quite remarkable. Quarantine measures were put in place to try to control the outbreak and protect the healthy population. The practice of quarantine began in the port city of Ragusa, which is now known as Dubrovnik, in the year 1377. Ships arriving from areas affected by the plague were required to isolate for 30 days. This isolation period was later extended to 40 days, giving rise to the term quarantino, which is where we get the word quarantine. This was a significant step in public health, as it aimed to separate the sick from the healthy. Cities across Europe implemented various quarantine protocols. For instance, in Milan, strict measures were enforced. Infected individuals were sealed inside their homes to prevent the disease from spreading. The city even built special hospitals, known as Pesthouses, outside the city walls. These hospitals were designed to care for plague victims in isolation, keeping them away from the general population. Quarantine was not just about isolating people. It also involved fumigating belongings and washing money with vinegar to reduce the risk of contagion. Authorities began to understand that the disease could spread through contact, so even those suspected of being infected were separated, regardless of whether they showed symptoms. The enforcement of quarantine laws varied from city to city. Some places strictly adhered to these measures, while others were less effective, resulting in higher death rates. Although these measures were sometimes unpopular and difficult to enforce, they represented one of the earliest organized responses to an epidemic in Europe. Overall, the quarantine practices during the bubonic plague involved isolating the sick and potentially infected individuals for a set period. Special plague hospitals were established, and movement of people and goods was controlled. These early efforts in public health laid the groundwork for modern quarantine practices we see today during health crises.